The discomfort that may be associated with dermal filler or any injection per se may be reduced to a minimum by observing 3 factors. This triad of pain includes firstly, common practice of applying topical anaesthesia, secondly, using ice just prior to injection, and thirdly, nuances in injection technique itself. Step 1. Topical anaesthesia. Here, apply 20 minutes prior to injection for sensitive areas. These would include the lips and base or tip of the nose. For less sensitive areas such as the jawline and cheeks, 10 minutes is adequate. Note, do remove makeup in the specific sites where you are to inject and cleanse the skin if there's excess oil, as these can otherwise be barriers to absorption. Step 2. Ice. Ice is a key factor. It reduces the perception of pain on average by 50% and more in some people, to the point where they don't feel the injection at all. It numbs instantly in contrast to the lidocaine, which is added to dermal filler, which takes between 20 and 120 seconds to work. You apply conformable gel ice packs, which shape around facial structures more easily than more rigid ice packs. You do so using the rule of 20s. So for every 20 seconds of injection, for example multiple injections when doing the lip at the vermilion border, you apply the gel ice pack for 20 seconds prior. By using ice, you also decrease the chances of bleeding and bruising, and it distracts from pain partly based upon gate theory. This explains that you have more than one stimulus in a local area, be it vibration sense, a strong squeeze, or cold, then the brain finds it more difficult to perceive pain in that region. The third step, or part of the triad, is your injection technique. The first thing to be mindful of is maintaining skin tension throughout your injections. You do this in mobile areas through maximal stretch, such as when injecting in the lips, or in less mobile areas such as the cheek or jaw by squeezing and doming up tissue. This also in these areas allows you to more confidently get your needle deep down to bone where you intend to deposit the filler. Secondly, you should be assertive when you insert your needle. That's to say that as your needle pierces through the dermis, you want to do it with an accurate, sharp, assertive, precise injection. This is in contrast to injecting the filler itself, which you want to do slowly and controlled. Whilst inserting the needle quickly and assertively, if you have an intention tremor or are nervous, to maintain the level of precision, make sure to stabilise your hand on the patient first. Additional important points to note. The ice gel packs stay sufficiently cold for 5 to 10 minutes. Therefore, for longer duration sessions, have multiple cold ready for use. Keep your needles sharp. Sharper needles pierce through the skin more easily and cause less pain, bleeding and bruising. You get 2 as standard in each dermal filler pack. If they feel blunt, exchange them. Signs to alert you to this can be increased discomfort for the patient or simply that it's more difficult to pierce through skin. To further decrease bleeding and bruising, squeeze firmly at injection sites. This makes local blood vessels spasm down by irritating them. A smooth sequence is to apply your gel ice pack just prior to injection, then after injection squeeze the injection site, and whilst maintaining that squeeze, replace the gel ice pack to your next intended site of injection.